we present a computer-aided diagnostic system for epithelial forms of ovarian cancer. Every 3.5 hours, a woman is diagnosed with ovarian cancer in Canada. It is the 5th most common cause of cancer death over all deaths. Unlike many other cancers like breast cancer, the outcomes for ovarian cancer have not significantly improved in over 50 years. Based on a histologic analysis of tumor biopsies, pathologists agreed on dividing ovarian carcinomas as 5 main cell types, including high-grade, endometrioid, mucinous, clear cell, and low-grade serous carcinoma. These subtypes show individual morphologic and cellular characteristics and must be effectively identified for targeted treatments. Their accurate identification is challenging and requires long hours of training for non-expert clinicians who often end up performing extra costly tests. Computer-aided diagnosis aims at automating cancer characterization for a more reliable, fast, and available diagnosis. However, these systems are impaired by technical variations proper to histopathology, such as staining inconsistency and acquisition procedure. Existing techniques proposed for the automatic diagnosis of cancer relies on an encoding of clinical priors as application-specific features into the automatic system. The limited knowledge we have of ovarian cancer subtypes not only results in a moderate agreement among pathologists, making it hard to mimic a specific diagnostic procedure, but also restricts the amount of information available for the design of specialized features. To address these challenges, we adopt a fully unsupervised feature learning technique that relies on the convolutional decomposition or deconvolution of an input image under a sparsity constraint. Each image is decomposed into a set of sparse feature maps that can best reconstruct it when convolved with learned filters. During training, we learn the set of filters and infer the feature maps that best reconstruct our dataset. This learning strategy is fully unsupervised and does not require any label information. As opposed to convolutional networks, we use a top-down approach to find a new image representation in the form of sparse feature maps. The deconvolution operation allows us to learn stable latent representations while preserving locality. We form a 3-layer network by building a hierarchy of image decompositions. Each level of the hierarchy groups information from the level beneath. We learn a rich set of low to complex features that are more suitable for classification using this deconvolutional network. First layers capture low-level information with edge-like filters, while higher-level layers can even encode complex cellular patterns. To represent the multi-resolution aspect of histopathology images, we use an adaptive filter size. Each tissue slide is decomposed into a hierarchical set of feature maps using the learned filters. The sparsity constraint groups information that exists over a large scale in the image while favoring a parsimonious image representation. This sparse multi-resolution representation can then be used to extract local image descriptors and form a dictionary of visual words. These local descriptors can be clustered by a series of Gaussian mixtures, and each image can be encoded by the distance from its local descriptors to the Gaussian mixture. This forms a high-dimensional feature vector. This encoding strategy enables us to separate classes in a high-dimensional space more effectively using a simple linear classifier. To summarize, we propose an automatic system for the diagnosis of ovarian carcinoma subtypes. Our system relies on a strategic, fully unsupervised feature representation which allows us to outperform state-of-the-art methods for automatic cancer characterization. We achieve an accuracy of up to 90% on a clinically derived dataset of 80 patients. Thank you very much for your attention. Please do not hesitate to approach me at the conference or contact me if you have questions.